Welcome to Thursday Thought Leaders with Harbinder Narula on BW Healthcare World. One area within healthcare that has been growing and getting attention is that of woman and child. And within this focus is the area that is related to birthing and fertility services. Today, joining me for a discussion on the business of fertility is Dr. Anjali Ajaikumar, who is the director of Milann Fertility and Birthing Hospital. She is spearheading the growth at Milann, and she's also been instrumental in advancing fertility treatments, contributing to India's emergence of global hub for such services. Let's speak to Dr. Anjali Ajaikumar. Welcome, Anjali, to BW Healthcare World. It's a pleasure to have you with us this morning. Uh, Anjali, before we get into this conversation around birthing space and fertility, I wanted to ask you, how big is the market size of birthing and fertility specialty hospitals in India?
See, the fertility space, obviously being the most populated country in the world, it is a huge space. And birthing space is obviously quite high. In fertility space in particular, we see that it's a huge growing trend. While we are not, I don't think, capped the potential at all, where while some cities feel that it might be overcrowded with IVF, we still see that there's a huge growth. Just to give you some examples of the growth, we're seeing that on average, we're seeing about a 16 to 18% growth, and it's about a 1.45 billion industry they're expecting by 2027. So we can see a huge growth in it. And there are a few contributing factors to this that is making it grow much higher. Of course, couples deciding to have kids a little bit later in life, and male fertility, infertility issues are on the rise. So these are, big contributing factors for a huge, unfortunate spike, especially in India. It seems that the growth is even more.
Anjali, what do you think are the biggest trends that are shaping the fertility and birthing industry in India today?
So I think the biggest trends, if we look at it for the country in fertility, we are seeing, of course, with the ART Act, the Assisted Reproductive Therapy Act, we are seeing that the good news is that there's more structure. And I think that structure is, coming into the new age of AI and other things that are coming into fertility space in how to do genetic testing, how to have, the whole process of IVF from the time that you get counseled to the time that you go through your treatments, the time you have your pickup, and the time that it goes through, goes outside, of course, and in the lab, and then you have a level of blastosis before they do an embryo transfer. So this entire process is changing, and each and every aspect of it is quite nuanced. So for a long time, people thought, okay, it's just I just go and get it. But now you're realizing that it's much more precision care, personalized medicine, and it's the same trend that you see across the different areas of super specialty.
So, Anjali, when we look at fertility, one of the discussions that always comes up and has been the metric for seeing how the success of a hospital or a center is the outcomes, the success rates, as they call it.
Yes.
And there have been a lot of technology advancements that have happened in this particular space. How have these advancements in fertility treatments such as IVF and ICSI evolved over the years, and what impact have they had on the success rates? And also, while you answer this, I also want you to ponder on the mindset of the doctor, the fertility specialist, uh, when they are, at the back of they're backed up with technology that can give them the confidence to create the success rates that are desired by the patients.
Absolutely. I think it's actually a very good question. When you're looking at the success rates, I would say there is one, I would say the unfortunate thing in the beginning is that each and every industry in India, people that are working this in the healthcare space have a different numerator and a different denominator. So that becomes very challenging when we discuss how do we discuss success rates. Now, I can say that in the month of December, one of our doctors who did, 12 frozen embryo transfers all got positive beta HCG. That means that she had 100% for that. But then that's fantastic for a beta HCG positive level, which means they're pregnant. But is it a medical pregnancy? Is it up to birth? So obviously that's a different outcome. Then you have a different outcome based on the couple's BMI to outcome, age to outcome. So there are many different factors, and I hope that as we as a country go forward, just like we've done in oncology and other things, we start having a standardization for how we deliver outcomes and how we say outcomes. So that's one aspect. The second aspect is, of course, using technology. Using AI, for example, to determine embryos and determine which are good, which are not, to help determine sperm to see which are usable, which are non-movable. Right now, a lot of it's dependent on the human eye. So these are, big factors. And of course, technique used in the operation theater for IVF. Obviously, it's doctors driven, but you have, for each patient, you have not just the doctor, but you have the andrologist, you have an embryologist. So each person's technique. As I sit for the last couple of years learning at Milann, it's a lot of technique and a lot of passion that goes behind it. We have embryologists that will come at 1 a.m. in the morning to make sure that the egg is hatching properly before a procedure happens, and how quickly you do the transfer from the embryologist into the patient. The number of seconds also matters, which I recently learned. So there are a lot of very specific aspects that help with the outcome. And I think in that regard, we are still, as most of the population is very much uneducated about it. They think, okay, I can just go, there's an IVF center, I see a board, it's close by to the house, I'm going to go there. And that is the challenge that we see, because it's a low barrier of entry. So anybody can set it up, but having the precision team, having the equipment, having an operation theater, having an embryology theater that has, the right type of gases, the right type of air quality, all of these things really help push the outcome. We have seen it firsthand where we have been practicing in one method. As soon as we have changed some of the methods of the air quality, or, putting in the right filtration systems, immediately we see a bump in the outcomes and we see that it's improved. So, I think that's very positive news for, I think, a lot of couples looking at treatment to say, okay, am I going to the right place? Am I doing the right steps beforehand? And of course, also the drugs that patients take. In a country where 20% of drugs are spurious, it's very important to go to the right place, take the right drugs, because all of that has an impact on the outcome. So it's not one answer doesn't kind of go for it.
Absolutely, I totally agree with you. And Anjali, everybody is talking about AI, big data, etc. And a fertility center has been having a lot of data available to them. Uh,
Yes.
you know, how are technologies like AI, genetic testing, and predictive analytics empowering the doctors, changing the way fertility and maternity care is being delivered through custom fertility services?
Absolutely. So I happen to know that one of our, and I might read it out loud to you, one of our head of embryology, who's a PhD in this, he has been working on using AI to develop models for ovarian stimulation. So this is not only developing the protocols, but they have looked at data of over 5,000 women, and they have looked at each and every aspect to look at what is the best protocol, and then training the AI algorithm to be able to identify. So that's one aspect. The other aspect is just, again, with looking at sperm, looking at what is normal DNA, what is not. So all of that, well, right now it's human eye and you're doing it with a lab, using AI is really quickly determining, but also more accurately determining. So what I always say with AI in healthcare is AI is a supplement for clinicians to help them deliver better care. It is not a replacement. Like many people think, oh, AI can replace healthcare. It can't replace healthcare because you still need, each person is so individual that you still need someone to have critical thinking to be able to determine what is the best clinical protocol. But definitely AI is a supplement.
And Anjali, we have AI. One of the things it does is providing predictive analysis.
Yes.
It also, provides enough information for a patient to take decision. And today in healthcare, there's been a lot of conversation around the patient autonomy. You know,
Yes.
so how can patients be empowered in decision making with data-driven insights to figure out what is the best treatment that they must choose with all data available to them?
Absolutely. See, I'll tell you for my personal experience, having gone through this, I would say that data is key, and taking all the different aspects of data, whether it's genetic profiling, looking at what you as an individual might be more likely to, what are the tests that you can take, what is your quality of your egg, what is the quality of your sperm, of course. All of these data points, AI, everything can help. And then, but I would say one of the differences, historically, you would say it's a one-stop shop. You go to a doctor and the doctor is giving you a device and you're looking at your treatment. But today, one of the things that Milann does, and also HCG does, is advanced clinics, or where it is a team of clinicians that is sitting and looking at all those data points, discussing before the couple even walks in, what should be the treatment protocol. And this includes an embryologist, an andrologist, reproductive medicine specialist, an immunologist, a psychologist, a nutritionist, a genetic counselor, just to name, I think this is, and then an endocrinologist. So this means that you need the specialities of all of these to be able to take that data, analyze it, and then give the opinion to the couple on what they believe is option one or option two that might be best for the patient. And then, of course, and involving the patient also in this decision making. I think a lot of times historically you would say, okay, doctor says you need to do this, you need to do this. But now we see, can I give you a choice? Can I walk you through all your data, what it means, and say, here's option A, here's option B, what do you think? And what do you think that your body is going to be ready for? This is the same in birthing. I'll tell you, again, based on personal experience, I'm obviously in healthcare, very, very spoiled in this world. So when I was about to deliver my baby, I had, two different hospitals had two different rooms ready for me. And I spent a lot of time educating myself, even though I had been in this field, that I wanted a normal delivery as much as possible. So I looked around the city, looked at who are the experts in normal delivery, and said, okay, I want to go to them. That was one. But the second thing was creating something called a birthing plan, which in India, it's not done. But globally, when you do your online research and you look at what my family members and others did in the US, it is a plan that you can do pictographically, or you can write as a list that says, what should be the lighting in the room? How many times do you want to be physically checked? How many, what should the music be? Do you want to have epidural, yes or no? Do you want to have an episiotomy, yes or no? Like you have a list of questions that you then kind of personalize for your taste and what you would like. And do you want, the kids vaccinated immediately or not? Do you want skin to skin immediately in the golden hour when the baby's born or not? So there is a, kind of a list of questions that we came up with, my husband and I. And then after that, we went and discussed it with our doctor and said, what do you think about these things? Yes or no? And once we put a plan, and it was red and green and kind of had colors, then we printed it out and put it, on the door of our delivery room, on the door where the nurses would see it, everything, to say, okay, this is what we want, and we are part of this birthing process. We are not just go sit there and listen to everything that we say. We said, no, it's part of the process that we want. And I thought that, do you want to sit on the bed while you're trying to deliver, or do you want to walk around the room? You don't want IV in your hand unless it's absolutely necessary. And, doctors will, of course, push back. Healthcare professionals will push back. What in case of an emergency? Say, okay, have the consents, we'll have everything ready. If need be, I'll sign it and you can do it. It takes 30 seconds. But this felt, empowering. And on top of that, going through, again, not done in India, which we really have to work on, is the couple going for especially their first child, going for Lamaze, understanding how important it is for both of them to be a part of the birthing process. Still today, it is very much left to the woman, and as though the husband doesn't have to play a role. But they absolutely do have to play a role in the birthing process, because it is better outcome for the baby when the woman is less stressed. And that stress level usually should, if they're with a partner who is helping them with breathing, is holding their hand, who is understanding what she's going through, then the outcome is much better for both the mother and the baby. So there is a lot of data coming out of how important these things are. And I think that is the really cool thing that's happening with the world of data and AI, that shows how much these things factor the outcome and the long time health of both the mother and the child.
Anjali, this is very interesting what is happening in in the West, and how we are imbibing the great things about the West in our country, uh, especially when it comes to, the patient empowerment. Uh, but let's go back to when a person is facing problem of the challenge around getting pregnant in the first place itself. Given the societal stigma and the conversations that happen around fertility, which has been there for many years, what steps do you think you are taking to nurture the stigma free environment in this area of healthcare?
Absolutely. I think there's a few factors for this. One is really looking at patient feedback and their experience, what they're facing, and communicating it back to the clinicians. For example, we have had patients that have come in that have said, and this is, of course, a few years ago, where they have said, the doctor has said, well, why didn't you get married by now? Then you wouldn't have to face this issue. Or, maybe if they're with a partner, well, just start trying right now. And not really understanding what that person wants and why they want to wait. I think that as through education, we have, taught our clinicians everything, that yes, you need to spend time and you have to listen, which is the hardest part, right? Actively listen. What is it that the patients desire? The second thing is having that infrastructure. For example, we have a clinical psychologist on the floors who are required to meet each couple before they start their IVF journey. And the reason behind it is to discuss with both of them, both individually and as a couple, what is it, why they want to do this, what is the challenges, are they ready for this, this path? Because sometimes it is, of course, family pressure. And also sometimes, is it really the clinically right thing? Because sometimes we see now, which I was surprised to see, that a lot of men don't want to get the checkups that is needed. So sometimes a woman is put through IVF when it's not necessary, because the man should have gone through a test, and there's a small procedure that can be done that can help their sperm. So now we're saying, and I'm a huge advocate of this, is doing the right treatment. So we'll do the right diagnosis. It's a mandate that every couple goes through all the tests, and it's a mandate that they get counseled, because these things allow more communication and doing the right treatment. And it takes, and to change the fabric of how majority of men think of fertility and their sexual health is a challenge, especially because many believe or come from families that believe that it can never be a men's issue. And we know that now it's 40% of men, 40% of infertility issues lies with men. But according to our andrologist, Dr. Praveen, it is growing rampantly, and it soon might be hitting 60%. Partially because of our phones, because men are keeping it in their pockets. The health of men sitting all day obviously doesn't help. There are a multitude of reasons that, and this is a global phenomenon where we are seeing sperm count coming down, male infertility increasing. So this is a big area that I think in the healthcare space we have to talk about, also in the public space, in order to kind of overcome some of the social backgrounds, baggages that people carry. And of course, I think the good news is that we're seeing more, public figures coming out openly talking about surrogacy, IVF, IUI, and that is helping people think, okay, this is part and parcel of it being normal. There's nothing wrong with it. Especially in urban places, we're seeing more and more people okay to even come out in patient testimonials and others to tell their story, which is fantastic, because I think a decade ago it was very difficult to get that. But of course, in more tier 2, tier 3 cities, we have to do more education and more awareness on this.
Anjali, obviously there's some kind of a study or observation of the last few years that is, the basis of what you're saying. Uh, what do you think has been the role of stress? I know mobile and radiation, etc., is causing a very big issue when it comes to fertility. But what I've heard is that stress is creating a lot of problem uh, in terms of fertility issues. Is that correct? And if it is, what do you think needs to be done for that? And how is that part of your treatment protocol?
Absolutely. I think stress is very, very crucial. On a personal level, I saw it firsthand with my own pregnancy. My doctor said last month you can't go to work. I said, "What's work? I love going to work. It's not causing me stress." And she was like, "Absolutely not. You can't go." So I went full term plus 1 day. And both my mother-in-law and my mother said, we were working so much when we were having you guys, that, they both delivered early. So we know that pregnancy and we know that gestation in the mother, the longer it is, and if they go full term, the baby's healthier. The baby has less, infections, their immunity system is higher. It's much healthier for them in their life. The same is true for, infertility and going through the process. The hormones and things that women are injected with in itself cause a lot of stress. You don't know what you're saying. You're basically getting pumped with progesterone and estrogen. You're getting pumped with hormones that obviously have an insane effect on your body. So on top of that, if you're taking work stress and you're taking, small things that happen, and then you're, going into emotional crisis, it is not good for your outcome. It's not good for conceiving. Now, the issue, what I think that a lot of people, of course, women in particular, but also men, because stress factor for men is also a big factor in infertility, is that, you have this desire that I have to grow in my career very, very quickly. And at the same time, it's my, fertility years where I need to be having children. Now, I have a little bit different philosophy. I love to work. I have been working in some kind of job or another since I was 14. So I can't sit at home for more than 2 days. But at the same time, I have realized that you have to do some balancing about what do you want. If you truly want to have children and it's something that you personally desire, you have to give the time for it. And that doesn't mean that you're going to be, I think, crimping your growth in your career. It just means that you have to pivot for a while. And I'll say there's some good news for women. If you have a child after 35, your chances of living past 90 is quite high. If you have a child after 40, your chances of living past 95 is quite high. These are new studies that have come out that are showing that your longevity is actually very much linked to your baby. And some of that stem cells from the baby is coming into you. Might be another reason why women just generally live longer. This could be one of the reasons. So so my philosophy is I'll work till I'm 90, but I'm going to balance my time and take the time that I need if I want to start a family. Take the time. Don't worry about what society is saying or if you're going to lose your career, but it's required of both parties. I don't think it just lies in the woman. I think while you're trying to conceive, it's very important for men also to exercise, to spend time with their partner, to be out in nature, because these are all things that scientifically show to reduce stress. Some of the things we do at Milann is we talk to to the couples about this. Some of the things that I'm trying to start to do is, can we give, a kit to the couples when they're starting off their IVF journey to have activities that they can do that will help reduce their stress at home. I know for me, one of the things was just coming home, sitting in one place, having something warm to drink, and making sure there's music playing out in the background. This was a recommendation from a doctor, and it really helped. It just helps calm and making sure you're doing meditation or breathing. That those activities really help that have a huge impact on your outcome. But people have to make time for it. And I'll give you one quick note during COVID. We, in HCG, we're running oncology centers, but also a couple multi-speciality. And we were looking at our numbers and we saw that there were no cardiac issues. Suddenly our cath lab was, empty, no patients were coming in. And we, asked our business, and what's happening? And he said, across the city in Gujarat, this was Gujarat, heart attacks have come down. Why? Because it was lockdown period and nobody could go to work, nobody could do anything. So actually stress levels came down. So probably all those people that would have had a heart attack just had it a little later. So they got an extra few months before having a heart attack. And because afterwards, of course, when things started opening up, we saw a huge number of increase, more so than before, because it was probably piled on. So stress has a huge factor. That's what we saw in COVID. We definitely see it in fertility.
Anjali, you were talking about the impact on the woman's body because of the hormonal injections. Now,
Yes.
is there any long-term impact on the woman's body because of these hormonal injections that she's being pumped up with uh, for later part of her life?
So they currently, I am not aware of any big significant issues because of it. But I would say that for people thinking that IVF is just it's not that invasive, it actually is quite invasive. So obviously natural, if that doesn't work, medicated, if that doesn't work, IUI, and then IVF. IVF is the last resort before surrogacy and everything else. So it does have an impact. Uh, there is not enough evidence that I am aware, again, I'm not a clinician, of what are the long-term effects. But of course, hormones have, you can gain weight, you can have issues where the body is holding on to these hormones long-term, and, to expel them takes some time. But I'm not quite aware of all the effects, to be honest.
And Anjali, one of the challenges that patients find while planning their fertility treatment is the cost of the treatment itself. You know,
Yeah.
uh, the this is a big challenge because the need for such treatment is now increasing rampantly, and it is not just restricted to metropolitan cities but also the tier 2, tier 3. In fact, it's a problem that we are facing as a population in the country. How do you think that this issue of affordability can be addressed by a broader range so that we can provide the treatment to a broader range of patients?
So it's a difficult question. I would say because there is an ethics to it, right? There is cost, but keeping in mind that India's cost of fertility treatment is almost 15 times less than in the US or in any other counterparts, even in some parts of Africa. So our cost is not so high, I would say, first of all. And I would actually, because of competition, other things, you always have this debate about cost. I firmly believe that for the right care, there is a cost. There is a cost to it. It's not, and I also believe that in healthcare, as a healthcare professional, there is a certain margin that you should not be going above. We're not in the hotel business, we're not in the steel business, so you should not be looking at a profit of too high also. And I think that's what we believe at HCG, that's what we believe at Milann. And we say, okay, and we also believe as Alyssa, I think Dr. Ajay has said this many times as well, that whatever we're taking as profits, we're trying to invest it back into our centers for higher technology, for better quality, for better outcomes. And that obviously comes with a cost. Now, and of course, talent. I think talent is a big, we see talent, what you would have paid for talent 5 years ago is not the same as what you pay for talent today. And rightly so, rightly so. You know, people, nurses, doctors are going through a lot of extra training, going through a variety of different modules in order to become excellent in their field. So these are factors that, of course, drive cost. On the other hand, with IVF in particular, it is a challenge because you're trying to bring life into the world. You are saying, I want to bring life no matter what, I want to do this. And you're saying, I'm going to go through IVF or I'm going to do this because I really want to have a baby. Now, that is a choice. Unlike maybe cancer or cardiology or something else where you suddenly get sick and you might not be able to afford. There are foundations, I run a foundation for cancer care where we get funding where we can help patients that can't afford. I have had doctors, of course, ask, can we do it in IVF? How can we do it in IVF? You know, when there are, I'll tell you on a personal kind of a side note, when there are 4 crore children in the country that don't have parents, when there are, you know, a lot of things that you can do to help, it's very difficult to raise funds for things like IVF. I know I went through the process of adoption. I've adopted my son, so we understand, and I've also gone through your fertility treatment. So it is a conundrum, and of course, every couple should have the right to choose. Every couple should have the ability to have their own child. I strongly believe in that, but cost is something that does factor, and it's hard to bring down. Now, of course, using Indian drugs helps bring down the cost, and I'm proud to say that our Indian drugs, give the same kind of outcomes. And people are obsessed sometimes with, international drug brands, unless it's an innovation drug that hasn't come generic. I think using that obviously brings down costs. There are other aspects of bringing down costs in IVF, like pooling. What we try to do is, if we have a lot of patients that can't afford, can we do it where the experts are there for a day and we can do all the procedures? So there are methods that we use in order to bring down some costs, but it's difficult to do it in this industry in particular.
And Anjali, other than the challenge around having experts or the talent available and available at a particular cost, what are the other challenges that you as an industry or as a hospital are facing? And also, are there some uh, challenges around the regulatory and how do you navigate across all these to provide
Yes.
quality treatment to the patients?
So I do think that there are challenges when it's a very confusing market for patients. And I think spending time, taking second opinions, spending time to go to the best place is very, very important. A lot of times, I think we are very impatient as people, and we obviously want convenience. We say, okay, the clinic is down the street, I'll go to that clinic. But is it the clinic that's going to give me the best outcomes? Is it the clinic that is going to give me personalized care and use the expertise, all around? Or at least can I go get a second opinion with all the expertise before I start a treatment plan? I think it's more effort from the patient side, but it is something that you should do when you're doing something that's invasive to your body. I think it's not because I come from healthcare. It's just, I would say this to anybody, anywhere. You need to do what's right for your body, take the time and get the opinions so you know you're doing the right thing. Number one. Second, again, impatience. Like if you go, for example, and you get an IUI with the doctor and it comes negative, global norms say if you're starting and you don't have any genetic issues or any other issues, you should be going for 3 to 4 IUIs before you do IVF. But couples come and they're impatient and they're suddenly asking for IVF when it may not be the right protocol. So here we have, this happens in fertility space, and this happens in birthing space. Shockingly, it happens a lot in birthing space where people are coming and saying, I want a C-section and I want it on this and this hour because it's not Rao Kala or whatever it is. And it is not, in my mind, it should be a clinical decision if you need a C-section or not. It is not a decision from a patient saying, I want C-section because I think it's easier. Is it right for you as a patient? Is it right for your baby? We should do always what's right, not necessarily what's easier. And our bodies are much more resilient than we think. We think, oh, there's pain, but what you realize is that pain you deal with at that moment, you actually forget about the pain very, very quickly. It is, and that's the beauty of being human. But we have to spend time with people, patients. We have to explain, we have to educate, and all of that takes time. And patients should also be patient to take the time and say, okay, if it doesn't work the first time, I should still continue with the same clinician because they're understanding me, understanding our bodies more, and creating the treatment plan accordingly. So it's not I tried once, now I'm going to skip to the next place and I'm going to skip to the next place. You're doing a disservice to a large part for yourself if you're not taking the time to do the right treatment.
But interestingly, I mean, what do you do in a case when a woman comes and says that, listen, I want the delivery to happen on this particular day at this particular time because my astrologer has said so? What do you, as a center, do as a response to this?
So we have been, doctors have come to us and said, we don't know how to handle this. We are telling them that, we can't do that, and they're insisting. So for a long time, a lot of doctors are complying. I am a strong believer that we should not, and it is not natural. And it is, when is it right for your body and when is it right for your baby? So we are saying, look, spend more time educating and saying, we're going to do clinically what's right for you. Tomorrow you can't come and sue because we didn't do this procedure in the right hour. But it has to be that we're doing something that's right for the patient. Have you dilated enough? Is your body ready to go through this procedure? And should you even be doing a C-section if you don't need to? So a lot of people, I have discussed with many women who think that's easier. Let me tell you, it's not. It is 2 years of healing because they're cutting over 7 layers of skin and stitching it in one line, which is not the same as how skin heals. Doing a normal delivery, if it's safe to do, is much better for both the woman and the baby and the outcome. Baby is going through the root canal. We know that it's very beneficial for the health of the baby to go through the root canal. We know that it's very beneficial for women. After 3 days after normal delivery, start to feel normal, start to heal. It takes 2 years for women with C-section to heal. It's a major surgery when you go through C-section. Yet somehow in our society, people have deemed that it's just a process. It's a major surgery. It is not a minor surgery. It is a major surgery. So I think educating, and I think the good news is that if you go and research yourself, you will see that these are the norms in the healthcare world. These are the norms that you should be going through. So I think that is helping people wanting more normal deliveries. And there are doctors that have been doing normal deliveries, and when you interview them, they say, actually, we get a lot of C-section patients for their second baby searching for a normal delivery doctor because they realize how awful it was.
That's actually interesting. And Anjali, you mentioned that in India we are offering, uh, we are probably the cheapest in terms of affordability for IVF or related fertility treatments.
Yes.
I'm sure there's a lot of overseas patients coming to India. Uh, so one is, where are we seeing, which countries are we receiving patients from? And what do you see as a future of fertility treatments in India for the world?
So great question. I think there is definitely a huge market for international patients. Currently at Milann, we see patients from Northeast, from Bangladesh. We are seeing some patients from Africa that we have gotten from various countries there. And we see that there's a potential in definitely other countries, including Middle East and other areas. The benefit for patients from international coming is that India's healthcare system is predominantly in English in urban areas, which is, what is easy to communicate and translate to compared to other countries. The second is that we have a lot of clinical talent in the country. We're not scarce on clinical talent, especially in urban areas. So, that people are getting filtered even in clinical talent before they're in an organization. We filter on their outcomes, we filter on the quality of care they give, the way they communicate to patients. There are many factors where in many countries there is no filtration system because there's simply not enough clinicians. So that's another, I think, good news that we have. And of course, our outcomes. For an international patient, come to the land that's most populated in the world, your chances of conceiving is much higher, obviously, right? But also that you are having all the same treatment protocols that you see globally. So we definitely see a huge potential. And also, I mean, for example, at Milann, we have trained almost 2,000 clinicians in ART or related courses in embryology and andrology and all of this. So we see that when you become an academic institute, when you become a training institute, you also see a lot more international coming. Like right now, we have a guy from Nairobi that is working as a fellow doctor, and he's giving great information about his experience. I met him last week. He's talking about how wonderful he's getting firsthand experience with patients. He's seeing a lot of cases. So when he goes back, he knows that he can do a lot of the cases, but any complicated cases, he's going to send, because he's like, for him also, it's a brand building for him that he says, okay, if I send a few, maybe I see 100 patients, I send a handful of those patients that are complicated to Milann, they're going to get a good outcome. That's better for me to build my business and build my practice. I would say not business, practice in Nairobi. So it's phenomenal how much international plays a part, and we definitely see that more patients will come. Of course, we don't know. I think internationally also we're now looking at, of course, Africa, Middle East, Bangladesh, and other countries. But I feel that even you will see more patients coming from Europe, from US, and other places as well, as the costs there are skyrocketing when it comes to this, and India's is coming down. Of course, in this, there's a challenge. The new laws on surrogacy, the new laws on donors, all limit international coming because it's much harder now in that aspect, which I think regulation is a good thing on that.
So this is interesting. I mean, the regulatory part, Anjali, that you brought up, because I remember I was interviewing a fertility center in the Middle East. And, much as I would have thought that it is not the case, but the reality was there was also a bunch of patients going from India to Dubai to get treatment because that is where the sex determination was not an issue, you know. Now, this is a very big issue when it comes to overseas patients who are coming in India. So, is that a deterrent for an overseas patient to come to India because the laws do not permit certain things which may be okay for in a foreign land?
Well, I mean, my opinion is clear that it's good that we don't let the gender out in India. We can see the data speaks about it, especially in various pockets of the country. We still have many more males than to females ratio in the country. But I do think that, the laws give streamline. You would see, for example, especially in donors, you would see women being multiple times donors, other things, which might not be the healthiest choice for those women. So I think putting some, I do think that they've gone too far, where they're saying only one time, which is a little, I think unreasonable. But I think it's just come out in the last couple of years, so I think it's going through an adjustment phase. And of course, not every, and I would urge the government here to make it more transparent and make it easier for couples to go through the process, because right now it's very cumbersome, very difficult. You're going through, the clinic, you're going through lawyers, you're going through different parties. It's a very complex, and it's not very easy. And that doesn't help the stress levels of these couples to conceive, obviously. So yes, it needs to go through some adjustment period, but it's definitely, I think, in the right direction to have some regulations around this. To do
And
ethically right practice, I should say.
I was just coming to that, because several times during the conversation, you mentioned that we focus on doing the right practice, we focus on doing the right treatment for the patient. India as a country, in fact, I think it's a global phenomena. People are losing trust and faith in the healthcare delivery system. People
Yes.
not trust. I mean, there was a time when a patient would go to a doctor with full faith, and today a patient goes to a doctor with suspicion and then goes for a second opinion to basically validate what the earlier doctor has said. You know, how do you think we can create a scenario or an environment where we are able to rebuild the trust and faith among the patients for getting the right treatment from the hospitals and doctors?
Yeah, I'm a huge believer in transparency. I'll give you an example. When I came in to Milann to help manage, my first conversation with our clinicians is, I am going to look at, of course, how many new registrations you've had, but I'm going to look at how many IUIs you're doing, how many natural conceptions, how many IUIs, and then how many IVFs. I'm not going to be having a conversation of how come you didn't do so many IVFs, but I will be having a conversation is that patient having trust with you? Is that patient coming back even for natural conception? Are they coming back for a consultation? So those are the indicators I'm going to look at. If a patient comes to you once and they don't come again for any kind of consultation, then it's a question mark to me that you haven't, communicated well with the patient. But I'm never going to come and say, how many IVFs are you going to do? And I think that, our doctors Milann has been known, of course, for 34 years and doing ethically the right thing. But our doctors, many of them came and said, we're so happy that you're talking like this, because we know that from our, colleagues in the market, that is not the conversation that others are having. There may be right or wrong in that. I'm not to say, but I will say that for us, it is recently a patient with one of our doctors was saying that a couple came, they had tried multiple times, various places, IUIs. The doctor sat with them, did a complete assessment and said, I'm going to try for 1 month with these medications. No procedures, nothing. I'm just going to give you these medications. I want you to do this, this, this. And they have now, I just got the call a couple of days ago that they have naturally conceived. That's great news. That's great news. And I'm happy about it because that's what we should be. We should be the destination that patients feel confident and have a trust. And I think I will say, a hand in hand to what the clinicians and having a team of 8, discuss with patients, hand in hand with this comes technology. And as we use more technology, as we have EMRs, as we have a digital footprint of the entire journey of the patient, patients hopefully will have more trust that they know, okay, this is transparent, and they have more trust in their entire communication because they have it in their hands also of what their treatment protocols were and what were the steps that they went through. So I think that comes hand in hand, and it's the same for all of us, right? We have more trust now. Aadhaar card came out. We have more trust that certain things happen because of that. We know that some more transparency has happened as we go more digital, even to get a driver's license before you would go through who knows what. And now okay, there's a digital, same for passport. So similarly, it's the same in healthcare. As you have, I think, more transparency and the more you communicate, the more trust someone is going to have. But when you try to hide, or when you don't completely say everything, or you're trying to be too pushy to a patient for a certain procedure, those get the hackles up and say, okay, do I trust this institution or not? Do it for the right reasons. I think healthcare, people have joined to be in healthcare, employees, regular front office staff, nurses, doctors have all joined healthcare for the right reasons. And we should, be appreciative of that. And also in the same front, also communicate better with patients. Like you should take care of them like you would take care of your own family member. If you do it that way, then, ultimately you might not have the short-term gains, but you will have the long-term gains.
Anjali, my last question to you is, uh, you're a healthcare entrepreneur. You're a non-medical,
Yes.
right? What is your advice to young entrepreneurs who are now looking at doing startups in the field of healthcare? Uh, there's been a lot of discussion around centers, businesses, healthcare related businesses that are being started by medical professionals versus those who have not been trained in medical sciences. What is your opinion? What is your advice to this young bunch of these wannabe entrepreneurs, specifically for healthcare industry?
Great question. So at this point, I have probably reviewed upwards of maybe 3,000 startups. Uh, I have had the privilege and pleasure of meeting entrepreneurs from around the world and within our country here. I have had, I guess, the advantage to also invest in some of these companies, both on a personal front as well as, through the work that I do and working on Lumos Health, where we look at startups coming in and helping them grow their clinical validation sales and revenues. I think there's no, you need to be a healthcare person to be an entrepreneur, but you do have to work with as a team. I think this team approach is something that we still have to do a lot in. There are clinicians who have brilliant ideas, but are simply seeing patients and don't have time to work on their innovation and make sure that it can go to market. There are people that are non-clinical that come with a passion or come with a pain point that they've seen, but have to spend time understanding how the healthcare ecosystem and landscape work in order to get it to market. And this is where we see bridging that working together is very, very critical. A single entrepreneur is not going to be successful. More likely, they have to be a team. Spend that time to get the right people in the team. I think, of course, and our ecosystem here is, while we do a lot of investment in startups, the base ecosystem of our educational institutes, where people are able to meet people from medical backgrounds, engineering backgrounds, business backgrounds, is still something that's hard to find. I know, like my own experience of going to Babson and focusing on entrepreneurship, the beauty of it was the classmates, the beauty of it was the ecosystem, that you saw people coming from medical backgrounds, business backgrounds, engineering backgrounds, finance backgrounds, and you're able to really develop a team to get your idea off the launchpad. And we see that startups that are coming from these ecosystems, whether it's Singapore, Switzerland, some of these other countries, they are at a distinct advantage than where we are. But I do think the good news is we're moving very rapidly and we're becoming more collaborative. So one of the things that I've been very passionate about in this is getting doctors, clinicians, and getting startups to work more hand in hand, and where they're both getting a benefit at the end of the day on the success of the company. Obviously, that matters, but then navigating healthcare, because doctors who are seeing patients, that is their first priority. Innovation is their second or third priority. So kind of having a network where we are working with fewer companies that are in the same space, along with a broader group of healthcare companies. When I first started this initiative, every healthcare organization said, no, we'll do it on our own. Now we're saying, now we have 75 hospitals in this network for our startup platform who are saying, let us collaborate, let us work together. If you see one company in the fetal monitoring space, and you have gone through their business, their clinical validation, then let us look at that, taking that company across our entire 75, rather than each one deciding someone else, because that's not helpful for the entrepreneur, the startup, nor is it helpful for the healthcare company.
Fantastic. Uh, Before I let you go, Anjali, one more thing that I'm very curious to know.
Yes.
Being a non-medico, being a young professional, uh, how do you navigate your way through very, very senior, very, very experienced doctors in the center?
Great question. Data, 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 I would say is the magic. See, I started off my career very young in India, moving from the US, where I came here for a cultural shock. And my first job was getting clinical protocols and getting doctor documentation done. This is way back in 2009, to the point where if doctors saw me, they would kind of turn around and walk the other way because they're like, oh God, she's coming after me. Now I have learned that data speaks volumes. If you're taking data of patient outcomes, or you're taking data of what patients' feedback is, and you go armed with that to talk with clinicians, and also I'm at a distinct advantage of being a daughter of a doctor, but also having been a patient in this space. So that gives a lot more, I guess, credibility for me to work with our doctors and to work on achieving better outcomes.
Actually, this has been a beautiful conversation because, half the things that I was asking you were not even planned, because everything was coming out of what you were saying. And it's one thing to talk about fertility, but it's a different thing to run a business around fertility. I'm choosing the word business because at the end of the day, we all need to uh, create a sustainable environment so that we are able to serve the patients, more patients, and continuously without having the pressures of not doing the right thing. Uh, the big takeaway is the last thing that you said: data, data, data. Whether we want to improve the medical side of the practice, the outcomes, the ability to do the right thing, to customize the treatment, to build efficiencies in the business, to have real conversations with the doctors so that you can help them do the right thing. Everything is related to the data which is available to us of what it was, what it is today, and what it could be. So I think that's a big takeaway from this conversation. Thank you so much for taking our time to speak with us at BW Healthcare World.
It was absolutely a pleasure. Thank you so much. I enjoyed the questions.